Thank you, Sue. I must admit I'm very impressed by her ability to summarize a lot of information very quickly. Good evening, ladies and gentlemen. I want to begin by thanking the Rotary Club of Nepean-Kanata for inviting Kathy and I to make a very short presentation to outline the work of the Western Ottawa Community Resort Center. It's kind of a mouthful to say WOCRC, right, Sue? In the close to 3 decades since this was founded, the center has grown to become an important part of the fabric of the community that it serves. It serves the western part of Ottawa and the surrounding area. And it offers a wide range of social, cultural, and health-related services to people of all ages and people from all walks of life. In a few minutes, Kathy's going to come up and actually talk to us about a few of the programs that are available. And we're neighbors. We're just down the street here. Our main head office is just down on Castle Frank. But suffice it to say that the service offerings of the center assist a large, a diverse, and a growing number of clients who depend upon the center. Clients, for instance, such as young families and their children who benefit from early years programming. Clients such as programs for youth. We offer counseling services for everything from bullying prevention programs to advice and support to new immigrants, or support to victims of abuse. We offer adult programs, and including several to seniors and to handicapped, several of whom actually can't travel to the center and depend upon such services as Meals on Wheels and a variety of other services. But generally, the center provides more or less the full gamut of service and health-related services to the community. And the center is very fortunate because we're able to count on the support of hundreds of volunteers who offer thousands of hours of their volunteer time on a yearly basis to leverage up the work of the permanent staff in delivering the programs that are part of the mandate of the center. On behalf of the community, the center is governed by a board of directors. Currently, we have 13 members, all members of the local community here. And their role is to provide leadership with respect to the values and the vision that frame the strategic plan and provide policy guidance for the management of the center. I would say that by way of a personal anecdote, Sue mentioned that I lived in a number of places across the country. But when my wife and I moved back to Ottawa the last time, having worked in all these cities, we decided to make this community our permanent home. And after we moved into our home here in Kanata, I decided I'd look around and explore the opportunity to join a volunteer organization, a not-for-profit organization, to try to, in my own small way, give back a little bit to the community that we live in. And I did a fair bit of research. Kathy knows this, she's heard me say this before. I looked at a number of organizations, but the one that kind of stood out for me as a beacon of the type of organization that provides a full gamut of services from A to Z was the Western Ottawa Community Resort Center. And that's what attracted me to join at that point. Just one last point before turning it over to Kathy, who's going to describe very briefly our program structure. Over the past year, our board of directors has adopted a practice of inviting clients of the center in to meet with the board so that we could actually hear from these clients firsthand on the experience that they've had in availing themselves of some of the services that are offered at the center. And this gives the board of directors an opportunity to stay connected to what the mission is all about. And also it gives us a chance to hear from those clients on what, if anything, we might want to tweak or modify in terms of some of the programs that we offer. But the one thing that has struck me in every single case was that every one of them has mentioned what a difference, what a positive difference the center has made in their lives. And that's really quite refreshing to hear that kind of commentary. And that's why I was pleased to, when the center invited me to join the board a couple of years ago, and I look forward to spending a few more years working in support of the organization as we celebrate our 30 years since we've been founded, and as we begin to implement our new strategic plan, 5-year plan, which Kathy is going to talk to us about. Thank you very much for inviting me.
Well, I'd just like to echo Robert's comments about thanking you for letting us be part of your evening tonight. I'm just curious, how many people here know Western Ottawa Community Resource Centre and what we do in the community? Few people, few less. There's a really good reason why I titled my presentation Western Ottawa's Hidden Asset. As Robert said, we've been in the community since 1986. And I can't count how many times we'll go out to the community and I'll meet people who say, I've always seen that building, always wondered what was there, had no idea. And then when they hear the range of services speak to us about, we just had no idea that it was here. So this is just such a wonderful opportunity to speak about the services that we do. I'm going to give you, did that work? I got one away? Let's try this out. Aha. I'm just going to give you a really quick overview because I was told we had about 20 minutes, so I'm going to do this really, really fast. I elected not to bring paper copies of everything, and so instead I handed out my business card, and at the bottom of my business card is our website. And so anybody who's looking for more information or more details, all of the information I'm sharing tonight is someplace on our website, so I'd encourage you to take a look there. But I'm going to spend just a few minutes talking a little bit about who funds us. A little bit about our service geography that we cover, the range of programs and services, and Robert's touched on a lot of them, but I'll give you a little bit more detail. I'm going to touch a little bit on the strategic plan, but what I thought maybe the Rotary Club might be more interested in is what we heard from the community as we did our strategic plan. I think that might be of value to you. I'm going to touch on we're celebrating 30 years, so there's a party coming. And then I'm going to close by giving you a little bit more information about what our clients are saying about us, because I think that's where the rubber hits the road and that's where it's most profound. In terms of our funding, 2014-15, our total revenues were a little over $6.5 million. We're getting closer to $7 million this year. And this next slide just sort of gives you a breakdown. So you can see the bulk of our money does come from the province, and then second largest contributions from the city. The catchment area I always do a double take. Western Ottawa Community Resource Centre is one of 13 community health and resource centres across the city of Ottawa. But when you take a look at our catchment area, we serve a vast majority. Our main catchment area is Kanata, Goulburn, and West Carleton. And so if you look at the, see if I can figure out how to do this. If you look at Kanata, Goulburn, West Carleton, of the city of Ottawa, that's about 40% of the geography of the city. And then when you add in that Nepean piece for some of our programs, we're serving about half of the city. It's a huge geography that we try to cover with our staff and our programs. The other thing is that I don't have to tell you that this is such a fast-growing area of the city. So in 2012, which is the last census data that's available to us, we were serving about 150,000 people in our community, about 15% of the city of Ottawa. That, over 6 years, increased by 39%. So the growth here is huge, and part of our challenge is that the resources and the funding for social services like those that we offer isn't growing as fast. So we're having to get really creative in how do we continue to meet the growing needs of our community. So just a quick, I'm going to do a real fast walkthrough of the range of programs and services. I'll start with community development. That's probably the one that people have the hardest time getting their heads around. Community development are workers who go out into the community and work with community residents to identify what issues they're dealing with and what kinds of things that they would like to do to address those issues. So one example is work that we've done in the Richmond community who identified the need for something for their youth in that community. And we've been working with them to develop a youth drop-in in that community. Out in West Carleton, we've done a lot of work around people living in lower incomes having difficulty accessing quality foods, and so have developed something called a Good Food Box program out in that area. So it's working with the community who identify what their challenges are, and then we support them to then find the solutions to those challenges through our community development work. Community support services, those are our services for seniors and adults with physical disabilities, and that's one of the programs that go right to Nepean. It's a whole range of services, and so you may have heard of some of them. Meals on Wheels, we do congregate dining programs, foot care programs, an adult day program for people with Alzheimer's or other dementia problems where they can come and spend a day with us. So a very large program. Just a couple of examples. Last fiscal year we did nearly 7,500 drives for clients to medical appointments. Our adult day program for people with cognitive difficulties, we served 106 clients that year. Children, youth, and families is a big part of our services as well, and again, a whole range of programs, a lot of them within the schools. So we do a lot of bullying prevention work, and we're really well known for the bullying prevention, and in fact leading a citywide initiative to develop a citywide strategy for bullying prevention. Homework clubs, anxiety programs for children who are struggling with anxiety. The Zone is a drop-in program here in Kanata, and we're just looking at replicating it up in Kanata North, and then workshops and partners. So an example again, and with these numbers to me sound huge, 1,300 children going through the bullying prevention program. This is done by a staff of 1.5. So it really is phenomenal, but it's about working in partnership with the schools to create a culture that will address bullying prevention in the schools. Our early years program, programs for children and the caregivers and parents of children 0 to 6, and that long blurb there, but it really is about getting kids ready for school and doing all the things, working with the parents to get the kids ready in terms of literacy and socialization and some of those kinds of things so that they have the best start possible in school. And again, some of the numbers, 2,600 children in 1 year and 2,000 parents or caregivers. And one of the things with this program is this community is such a fast-growing community that the demand for services for this particular service is just phenomenal. So we've had to get really creative in how we offer the service so that we can see those numbers of individuals. Our counseling service, we have free counseling. I think that's one of our best kept secrets, unfortunately. Free counseling for people who need it. It's confidential, short-term, and crisis counseling. And to support people who need our service, we can help them out with transportation or childcare, or if English isn't their first language, we can arrange for interpretation to support them. Last year we served nearly 2,000 individuals, and we're through so about 1.5 times per individual who would come and see us. I was just talking to the manager of the program today, and she was just telling me people have this image of the West End of Ottawa as being very affluent and very together, and she was saying that the numbers that we're seeing this year just are skyrocketing, and the complexity of needs that people are coming in with severe mental health needs, trouble making ends meet financially, is just skyrocketing, and so it's certainly a challenge to keep up in that area. Violence against women is another one of our large programs. This slide talks about our counseling program. We do counseling with women. We do counseling with children who've witnessed violence. We run group programs. We do some work with CAS. And again, some of the numbers from last year, 53 children who witnessed violence were supported by this program. Partnership with CAS, we saw 125 women, and that translated into 185 children, and 1,600 hours of counseling sessions provided to women. Chrysalis House, some of you may have heard of Chrysalis House in our community, so it's also under our umbrella, a 25-bed shelter for women and children who are fleeing from abuse. And you can see the little bullet at the bottom, 167 women and children served last year. Sad news is turned away 307. The need for shelters and affordable housing in our community is just one of our community crises that we need to pay attention to. We can't do any of this without volunteers, and I put this up. It's a really busy slide, but it just shows that for each of those programs I just went through, there's roles for volunteers throughout those programs. Last year, 239 volunteers, 26,000 hours of service on our behalf, and I have to say, I think that's an underestimation. I think our volunteers often go over and above in helping out the people that they're serving, so 26,000 is probably a very conservative number. As Robert said, we moved into strategic planning last year, and part of our strategic planning process is a real commitment to hearing back from the community and from our partners about what's important to those communities and partners. And so we ran a number of focus groups for a youth focus group, a francophone focus group in our rural communities, tried to touch as many people as we could. We had an online survey and in English and French as means to hear from the community about what's important to them. And we asked them 4 questions. What's most important to you about your community? What are the biggest challenges that you see in your community? What's one thing that Ottawa could do that would have the biggest impact? And then any other advice they might have for us. And what we heard back from the community, and this was one of the things I wanted to share with you, is that what we value is probably stuff that you would recognize. So valuing a clean, safe neighborhood, the recreation, the green space, the friends, the neighbors, the connections, schools, access to healthy food, access to services and resources. But the community also told us that there were issues that were struggles for them, and public transportation was at the top of the list. And for a suburban and a rural community, if you don't have a car, it's very, very hard to get around, to get jobs, to get to school, to do other kinds of, to get to social services. The other 2 were affordable, safe housing and mental health services. And so what they told us that we could have an impact on is to take a look at things like mental health support, access to health care, services for seniors, focusing on wellness, focusing on children with special needs, really paying attention to the most vulnerable in the community, an advocacy role, and a presence in the rural communities. So this next slide is just a way to pull all those words together, and really what jumps out is for people to be able to have access to the resources that they need. So this very busy slide is our strategic plan. So this is what the board has told me I need to do in the next 5 years, and it's easy, right? But really wanted to highlight that the pieces across the bottom of the slide, it's really that's the foundation that we're going to be working on. And so engagement is one of the really, really important pieces, and that's about working in partnership. And so working in partnership with all of our stakeholders in the community, and Rotary of Nepean-Kanata is absolutely one of those stakeholders. So I'm hoping this is the beginning of continued conversations about how we can work together to meet the needs of the community. But also starting to do more work around how we measure our results, so that we can say to our funders and to decision makers about what's the needs in the community and what are the impacts that we're having. And then a lot of the pillars are about how we're going to move ahead. So looking at flexible adaptive services, looking at our hours of service. Traditionally, organizations like ours are Monday to Friday, 9 to 5. Well, people who are needing help often are working all day, so we need to start looking at evenings, we need to start looking at weekends, we need to start looking at how do we offer those services even further out in the community, because it's hard for people to get into the resource center. Looking at more ways to connect, and that's using internet, social media, looking at languages, trying to expand our ways to connect with people that we're serving. Continuing to invest in our partnerships is a big piece that we're going to continue to focus on. Making sure that we've got a strong foundation. Our volunteers and our staff are the backbone of making sure that this happens, and we need to pay attention to meeting their needs and making sure that they are the best prepared board staff and volunteers possible, or we won't be able to do the work that we need to do. And then definitely a role in terms of advocacy, and our advocacy is advocacy on behalf of an individual client who maybe is having trouble working their way through the social services system, or it might be advocacy within our political realm, so advocacy with the city about affordable housing, about access to transportation, about access to childcare, or advocacy sometimes at a policy level, so making sure that we're at those tables. So I wanted to I would have loved to have had a video or a client come with me, because I can say all the things I want, but when you hear it directly from the people who are impacted, it just means so much. And as Robert said, we've started at the board meetings inviting a client to come and tell their stories, and they are powerful, powerful stories about the struggles that people have had and the kinds of resources that they need. But what I've done is I just pulled a couple of quotes from some of our clients. One from a transportation client, so a senior who was receiving our transportation services, talked about, "It makes me feel more independent, that I don't have to depend on others. Seeing all my immediate family are gone, it's nice that I have someone to depend on. Thank you so much." Our Diners Club, where people come together for a congregate dining opportunity, a hot meal, and then often some sort of entertainment or social piece, told us that the most important aspect of this Diners Club attendance for me means that I don't have to eat alone, and it helps me connect to my community. One of our Early Years Center programs, I thought this was kind of neat. The welcoming environment, in fact, including the lack of a registration fee, was fabulous for me as a father who had just begun parental leave and was uncertain about some aspects of caring for my baby all day. Our homework club, a little grade 5 student, told us, "I used to get C's and B's, and now I'm getting B's and A's." Speaks volumes. Our Children Who Witness program, so these are children who have witnessed domestic violence in the home, and we're supporting those children. A mother told us, "My son demonstrated much more confidence in himself. He now sleeps alone and doesn't feel as scared. He also realizes that other kids have been through the same thing." And our counseling services, the counselor's been very helpful and supportive to me. Without them, I would have had a breakdown. I appreciate the work by the VAW team. They help, that's Violence Against Women, they help support and assist where necessary. Help is just a phone call away. So just a few highlights of who we work with. 30 years, hard to believe. 1986, a few very, very committed residents of this community came to a table and said, "We see people who are struggling in this community, we need to do something about it." And so they worked really, really hard, they put some money together, and they started the Resource Centre of Kanata. And since then we've grown to serve Kanata, Goulburn, West Carleton, and Nepean. 30 years later, we're the building on McNeil Court and out in the community in so many different ways. So I often wonder, well, I don't wonder, I often think about, did they ever envision this happening? Some of our founding members, Marianne Wilkinson was one of our founding members of the Resource Centre, and Heather Culls, who used to be at the food bank, was also another one of our founding members. And so I tried to do this real fast, and I'm sorry if I went too fast. There's lots more on our website. I'm happy to answer questions, but I think if I could leave you with one message, the message would be, if you know somebody, if you need some help in your community, if you know of somebody who needs some help, there's a lot here. We also have a lot of connections to other resources and other people, and if you just phone the main line at the center and ask to speak to somebody, we can help you find your way to what you're needing. A reminder, I did pass out my business card, and take a look at the website. You've also going to have my email and my phone number. I'd be happy to answer any other questions. I'd also be very happy if any of the topics that I talked about you'd like to hear more about. Sometimes people want to hear a bit more about some of those programs. People from our centre would be so thrilled to be able to come and speak to you a little bit more about each of those programs. I think when I was phoned asking if I could speak at one, I said, "Can I have them all?" But I think I have to take my turn. And then just I want to close by ending where Robert started off. I want to say thank you very much for the opportunity to talk about the Resource Centre. And we have, as Robert said, 13 board members, 240 volunteers, about 80 staff, and what drives everybody is the passion and commitment for what they do for the clients that we serve. And so really thank you for that opportunity. And I also want to thank you, because one of the things I should have said thank you about when I put my money in the box, do I have to pay more? Is one of the best things about working in this community is we have people like yourselves who are also doing so much for this community, and it's the community, we build the community we want. So thank you for you for what you do as well.